question. One of the things that I find most beneficial for initiatives throughout the world would be finding emerging markets, the new businesses, just as you were mentioning here, that would make things inherently sustainable. And so, Joy, one of the things I was curious about with Johnson & Johnson is you mentioned it being a purely philanthropic arm of the company. So how does Johnson & Johnson envision sustainability in their initiatives that they're
Our particular arm is a purely philanthropic arm. There are many other, we are in the corporate, at the corporate head, and we do have philanthropic efforts in other areas of the company. But for us, even though we're a philanthropic arm, our intention is not to do one-off programming and never create any sustainability. I mean, everything that we do, our hope is that eventually it will lead to a sustainable program. So, for instance, the example that I gave you with neonatal resuscitation, it's anticipated that it will be sustainable within the next 5 years. And I also failed to mention that we did in an evaluation of 322 hospitals, there was a 54% reduction in neonatal mortality. So everything that we've done along the way for this long-term partnership has been to create a sustainable infrastructure so that this would be a part of the normal healthcare system. And it looks like it will happen.
Just build on that, and maybe taking a little bit of the comment you made earlier is this idea of the corporate social responsibility versus having something that's in a business interest. And I think one of the concerns all along has been that if corporate social responsibility is the only driving factor for an industry to be engaged, when times get tough and the belt tightening occurs, those are the first programs to go. And so I think there's an interest in looking beyond just corporate social responsibility, not that the CSR piece isn't playing a hugely important role and is responsible for a lot of great gains that we've seen in global health, but if we can continue to look to find ways to make it in a company's core business interest, then you have the potential for them to have a much greater stake in the process. And I'd note that it's interesting, Pfizer was, a few years ago, they merged a lot of their global health programs right into their emerging markets section and completely revamped how they were looking at these markets. And it was a clear indication of where they saw the merger of the two and the opportunities. And it was very much of a pure business focus in terms of how they were looking at those markets. So both are really important areas.
Others? Questions have been excellent. Yes, Chris.
Question actually is really for Juan Carlos, but it's for the entire group as well. My background is also in operations research as an undergrad, and it makes me frustrated when it's difficult, when you can't actually find a causal link between your intervention or your collaborative partnership and actual impact for a variety of reasons, and perhaps most importantly, the noise associated with a variety of organizations and other interventions targeted at the same, in your case, I think you mentioned in Peru, maternal newborn child health program with a focus on nutrition. How do you, based on your experiences, kind of manage that based on all the uncertainty and also appeal to the needs and the interests of all the partners, not just the donors, but also the implementing partners?
Thank you for the question. It has been always a major challenge, particularly to get into the attribution issues for more rigorous, whether those are operations research studies or impact evaluation studies. And the challenge is because the more you go up to the higher levels or higher coverage levels within a particular geographic area, and in this case at a country level, the harder would be to address those issues of confounding factors or trying to control for spillovers or impact heterogeneity and so forth. So so I'm not going to address those, but I think more and more donors and other stakeholders are recognizing those particular challenges, and there is also even still a big debate about the randomized control trials as the gold standard for measuring impact. I think things are changing now. If you hear some of the major donors, they are a little bit more interested now in the contribution that particular programs or interventions can provide rather than the attribution. If we're talking at the district level, or maybe in some points at the subnational level, there are still ways to address the proven effects and evidence of different kind of interventions. We just recently finished one rigorous study in Kenya, for instance, in which we were able to include 67 teams of health managers, including health administrators, doctors, and physicians who received leadership development intervention. And we did a quasi-experimental design. In the absence of randomization, we tried to match for comparison groups in other areas of Kenya that did not receive the intervention. And we have been able to prove the effects and impact of leadership development programs on health outcomes, including family planning, maternal and child health, and reproductive health. So there are ways to do that. They're not easy, and they cost resources, and it takes time depending on the intervention that you are studying. Obviously, if the intervention points to change behaviors, depending on the behavior that you want to change, the timing will be needed, as different behaviors are easier to change than others. So I'll be happy to share with you details of this study that we just finished.
You talked about the challenges of a private-partner partnership, especially the first year, for example. Do you have tips or, for example, communications? In the example that you gave, you had to speak to the 4 different partners and nobody even realized you were doing that. The communication process, are those roles clearly defined at the beginning? And how, do you have some tips for us on that? Because I think that's a challenge I've heard over and over.
I thought it was very interesting on the panel. I think that Hugh had mentioned it also about having a common vision, and I find that these multi-sector partners, or GDAs, the Global Development Alliances, have done their homework there. They have come together, they have a clear mission and vision, they have objectives laid out, but they haven't figured out how to communicate among each other, or, this was a very interesting one too, how to accept a funding stream among all of them. So in other words, each partner is asking for a separate funding stream, and sometimes even for the same country. So it's really, as a private sector partner, it becomes a little confusing and a little bit, I buy into the mission and the vision, and these are good partners. You've either worked with them separately before, or so you know these are the right partners and these are the right groups to get it done. But they haven't figured out among themselves. I don't know, I think they need a basic RACI chart. Who's responsible, who's accountable, I'm not really sure how to resolve it, because you've got big organizations, each with their own objectives, aside from the Global Development Alliance, so I don't really know how they need to do that, but I think a lot of these partnerships are very new. And so they haven't figured it out, and in fact, some of them have been in partnership for more than 2 years and have still not figured out how to communicate. And as a result, I have to be honest with you, some of these do not have a large corporate partner. And part of that may be because of these issues. And when I've approached them, they're very definitely open, but haven't figured out the process. So, but I think if they streamline the process, they would end up having a lot more partners want to come in, because the objectives are right, the missions are, the mission is right, the current partners are right, they just don't communicate. It's kind of business as usual.
Yeah, so I'll actually ask you to, you can look at later, there are 2 documents that we've provided in the packet. At PATH, because of our long history and the issues that we've constantly run into in working with private sector partners, we've tried to crystallize that in a couple of ways. One document in there is our principles for private sector collaboration. This is a document that we provide to all of our private sector partners, and it basically outlines our expectations for how we anticipate working with them and the kinds of things that we expect out of the partnership. The second document in there is a 4-pager on maximizing the benefits of public-private partnerships. And that really draws lessons that we've learned out of our history of working with private sector partners and really looks at 3 of the sort of most difficult issues that we find in our discussions with private sector partners. And those include issues around supply, around pricing, and around intellectual property. And so both of those documents are things that we provide to our private sector partners to help set expectations about the kinds of things that we typically will engage them on in our discussions.